Hi everyone, welcome back. Today we are going to study about burns. See, in burns we are going to study about the type of burns and the different degree of burns a person can suffer from. If you see, burn are referred as heat injury to the body. So whenever something heated comes in contact with your body, that is when you get a burn injury. Now these burns can be of two types, thermal and non-thermal burns. Thermal burns are the one in which there is a direct heat injury which is occurring. So for example, there was a hot pot, you touched it with your bare skin, that is what you say as a thermal burn. The subtypes for these are the contact burns, flash burns, flame burns and the scars. See, what are contact burns? When your skin is coming in direct contact with a hot object. So the name itself is telling you that a contact burn is when there is a direct contact of the skin with a hot object. Okay. Next we have is a flash burn. What is a flash burn? When there is an exposure to the gas leak. Imagine a person is inside a building and there is gas leaking inside the whole building. And at that time only he lights up a matchstick. Now what will happen? There would be a huge exposure. That huge exposure will lead to a widespread injury, a flash burn injury. Next is a flame injury. So this is also, the name itself is telling you that exposure to the naked flames while you're working with a Bunsen burner, at that time it can happen. Next is scars. Now scars is something different. This is when your skin is coming in direct contact with a hot liquid. Now the severity of a scald is going to be much more serious to any other type of thermal injury. Moving to the next type, that is the non-thermal burns. What are non-thermal burns? These are the indirect injury occurring due to heat. So here you are not having a direct contact with the heated object or something. There is an indirect injury which is happening, like the UV rays burn, the electrical burns or the chemical burns. Remember, when we are on a beach, we might get sunburn after we are exposed for a really long period of time, right? We have sunburn, right? That is an example of a non-thermal burn. Electrical burn and chemical burns are the other subtypes. Now coming to the degree of burns. In the degree of burns, first we need to see the anatomy of what skin looks like. Skin in the superficial layer has got epidermis. Now epidermis is the first superficial most layer. Here in this layer there are no nerves, and even if the nerves are there, they are going to be very fine nerves. Okay, but no major nerve is there, no major capillary or artery is going to be there. And then we come to the dermis, which is the innermost layer to the epidermis. In the dermis, you can divide the dermis into two types. The first is going to be the papillary dermis, the other one is going to be the reticular dermis. Now both the layers of your dermis is going to have certain amount of nerves. Always remember, epidermis is something which will never have any nerve endings. Okay, very fine nerves can be there, but majorly कोई nerve नहीं होती है. देन वी टॉक अबाउट डर्मिस. डर्मिस में आप दो टाइप से इसको डिवाइड कर सकते हो. सुपरफिशियल पार्ट जो होता है डर्मिस का, दैट इज द पैपिलरी लेयर, द सुपरफिशियल पार्ट, एंड द लोअर पार्ट, और यू कैन से द डीपर स्ट्रक्चर to your papillary is said to be the reticular dermis, right? We have to remember this anatomy. Now let's see the degree of burns. First burn कौन सा होता है? The first degree burn. Here you are going to see that only the epidermis is going to be involved. So what is the epidermis? This superficial layer here. This superficial layer, this is your epidermis. So when only your epidermis is involved, that is what you say as your first degree burns. Here nerves are not going to be burned as such, but yes, they can be exposed. Okay, so as I told you that there are going to be very fine nerves in this layer, in the epidermis layer. The nerve endings are going to be very fine, and maybe some deeper nerves which are there in the dermis, they might get exposed, and due to that these kind of burns, that is the first degree burns, are very very painful. Moving ahead, there is no blister formation which is seen. Usually they heal within a period of 3 to 5 days, and no scars are being left, which is an important point. Coming to the next one, that is the second degree burn. The second degree burn, they are also said to be superficial burns. Why do I say them to be superficial burns? इसमें पूरा epidermis involved होता है, and with the epidermis, the superficial layer of the dermis can also be involved. And what is the superficial layer of the dermis? It is the papillary dermis. So यहाँ पे क्या होता है, आपका dermis के साथ साथ जो papillary dermis होता है वो भी involved होता है. These burns are extremely painful because again there are going to be slight nerves which are going to get exposed here. Blister formation is also seen. Healing here occurs in less than 2 weeks, and here also no scar formation will be seen. Next what we see is a deep second degree burn. Deep second degree burn में क्या होता है? With the epidermis, the papillary dermis is also involved, and also a part of your reticular dermis is going to be involved. Remember, I am not saying that complete reticular dermis is involved, just a part of your reticular dermis will be involved. Here also the nerves are going to be burned. See, when nerves are completely burned, then in this case no pain is going to be felt, or maybe just a very little bit of pain will be felt, because nerves are the one which will make you feel the sensations, and when the nerves are burned, obviously the pain is going to be relatively less. Here also blister formation will be seen. Healing here occurs in 4 to 6 weeks, and a scar formation is seen here, which makes it the first difference, or a very you can say severe type of burn, because here the scar formation will be present. Moving ahead, we have the third degree burns. Now third degree burns, on the severity, I hope you all can understand this is very, very severe. Here full of the epidermis, full of the papillary, and the full thickness of reticular dermis is going to be burned. So now you can imagine that all the three layers, your epidermis, your papillary dermis, and the reticular dermis, everything is burned here. Now as everything is burned, there would be no blister formation seen, no pain will be felt, because here now the nerves are completely 100% burned, and so no pain is going to be felt. Non-spontaneous healing will be there, and a massive scarring will be left. Lastly, we have the 4th degree burns. In the 4th degree burns, you can see here, along with the burnt skin, there is involvement of fat, muscle, and bone also, which are burned. Amputation is the only solution here, which means that if the leg, for example, if a patient's leg has burned completely, like a patient's leg has suffered a 4th degree burn, in this case the only treatment or the only solution we have is amputation. What is amputation? We basically give a artificial or a prosthetic leg to the patient, okay? That is known as amputation. So this was all about the different degree of burns and the type of burns that we have. We have further classifications for the electrical burns as well as chemical burns as well. If you want, do let me know in the comment section. I'll make a video on that also. Like, share and subscribe. Thank you.